We're talking about bladder cancer. Unfortunately, these cancers are killers. And one of the common themes that we've learned from talking with and asking Dr. Thomas is early detection obviously is key. And you hear doctors and you hear medical professionals say this stuff all the time, whether it's the people on TV or the people that you see in the office. And unfortunately, for a lot of people, they don't go to the doctor often enough to test these little things and find out what could be going wrong. So, Dr. Tom, with regard to bladder cancer, what are the signs and symptoms of bladder cancer that you might notice if you're not going and getting regular checkups? What could be going wrong?
Sure. So the signs and symptoms of bladder cancer would include things like blood in the urine, maybe some pain. It might be like abdominal pelvic pain. So you would say lower down in the abdomen. Frequent urination would be another one. Maybe pain during urination, and sometimes lower back pain. So those would be the common symptoms associated with bladder cancer.
Is there any when you describe some of those symptoms, and even when you earlier when you were talking about what bladder cancer is, you mentioned men and their prostate. Is there? It makes me imagine that maybe bladder cancer might be a little bit more common or a lot more common among men. Is there any sort of differentiation between the sexes when it comes to risk or actual diagnosis?
So in preparations for today, it didn't really show up that bladder cancer was more common in men than women. But I will say this, right now, all of the bladder cancer cases we have are all female. I can't answer that at this point if that means across the board for everyone else. I think one of the challenges is that when we get into talking about the different types of bladder cancer is when we look at imaging scans and sometimes diagnostic reports or pathology reports, when patients coming in, they don't always have it listed as bladder cancer. They may be listed as urothelial carcinoma or some other type of cancer. So the people then may not even know that what they have is a bladder cancer versus some other type. So it might be a little bit more confusing that way. So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So whereas someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.